third batch for the year. Oops. Thank you. This would be the third batch for the year, and so we'd like to invite you all to have an open heart and mind as we go through all the data that we'll show you from the previous camps. Part of the lecture is to try to show to you what the trend of today's health looks like. So how healthy will your families be in the next coming years? And so we entitled it Our Health Beyond 2020 because we really went through a lot of things the past year and a half. We're also going to try to show you how when we try to track data, interpret it, and we try to solve it, there's really this one model we've come to the front that's actually very very effective in treating these things, and which is the model of functional medicine. So for today's lecture, everyone on the call, we had about 32 respondents. I believe we don't have all 32 participants today. Some backed out last minute, but 50% of the respondents were aged 25 to 30. We have 18.8% at age 31 to 35. 9.4% of you are within 36 to 40, and the rest at 41 to 45. So we don't have, or we have a really a small amount of percent of participants coming in the 50s to 60s range. When you answered what symptoms you guys experienced, you had mentioned that of note really were your muscular issues, no? So back pain, muscle pain, and all these other pains across the body. You have anxiety, you're experiencing low energy, bloating, and the other lists are the ones noted as well there. Why are you here? Spread equally across 5 different categories. We have 20% per participant. You want to be strong for your family. We have you want to live longer and to be healthier. You want to lose weight. We have you want to have more energy, and finally you want to solve a certain problem that you've been concerned with. So our outline for tonight would be to look at the following main topics. We'll look first at the reductionist approach of healthcare, how health has evolved the past years since the inception or since we started to actually treat people continuously. And we're going to try to look at the environmental trends and moving forward, how do these trends in the environment translate into health outcomes for us today, for your family, for myself, for our patients. Then we'll try to show you, or I'll show you the data from our previous health camp, which is the Once Daily Campers experience, and finally to kind of show you some details about how the August camp will run, to give you a better picture of if you do intend to sign up and proceed to sign up, what will you expect during that whole month. So to start off, we know that science has evolved across the span of medicine, and when medicine started, for scientists who try to understand the human body, we tried to break things up into smaller and smaller Lego pieces. So that's the reductionist approach to healthcare. I believe the one who found out about this was Descartes, if you're familiar with that philosopher. And with that reductionist approach to healthcare, we found out as well that there are many organs in the body. You have your heart, your brain, your liver, your lung, your skin, etc., etc. As we started to subdivide a lot of these organ systems, scientists started to create different therapies for different organ systems. One such miracle drug was the discovery of penicillin, which is an antibiotic, and discovered by Alexander Fleming. And they used penicillin first off during World War One, and I think World War II as well. And they said that this is a wonder drug. It's able to treat multiple different things across that try to kill human beings. And so in this newspaper clipping, you can see here 500 cases prove penicillin's value, making it a very remarkable, potent antibacterial agent. Then there were these landmark cases. They'd go to Africa, try penicillin on different conditions. In this one condition, the kid in the photo on your left side has syphilis. So that's Treponema pallidum infection. And after a round of penicillin, all the lesions start to go away. So how miraculous, right, for one type of treatment. But sometimes they found out that penicillin doesn't work in venereal disease or gonorrhea. It's the wrong bullet for that type of disease. And so out of the woodwork came multiple different researchers who tried to figure out, so if penicillin doesn't work for these types of conditions, what then can we use for the other types of conditions that try to kill mankind? And there came about the drug discovery trail for antibiotic therapy. You have penicillin, streptomycin, cephalosporin, and the list goes on until today. Apart from the drug discovery for antibiotic therapy, they started to discover multiple medications to try to target chronic inflammation. One such research won the Nobel Prize in the Mayo Clinic, and this was by the two doctors on the left, this is Hench and Kendall. And what they did really was they took a patient inside the Mayo Clinic operating theater. They put the patient in front of the audience, and they showed them that this person had rheumatoid arthritis. So that's an inflamed ankle on the lower left-hand side. And they got some corticosteroids from the adrenal gland of pigs and injected it on the site. And quite miraculously, within minutes, the inflammation started to go down, and then the person could walk again, and the inflammation wasn't there. And thus was born this concept of health, where for every disease, there's one drug that we can discover to try to treat that disease, which actually today we still try to apply this model for a certain type of condition. With that discovery and with that new model, regulators in the US started to say, we have to regulate this. No one can just pull out medicines left and right. It has to be well documented, researched. And so they started to develop these stringent pathways for research and production, which are the steps for clinical trials. And the sequela of creating these steps was just the higher cost to prescribing drugs and giving medications. The research cost was so high that if you look at this table right here, in 2015, I believe, all the medications on the left side, you have here immune modulating medication. That's Humira. You have fluticasone. That is a inhaler. You have insulin. You have statins and the rest of the medications there. You'll see that the prices really differed across the different countries based on how they were regulating the marketing spend of each of these companies. When the companies would declare their marketing spend for the end of the year, they said that, at the end of the day, we charge a lot for the meds because we're allocating about 70 to 20% of our resources for drug development and payment. So trying to justify that course of why they were charging a lot for the research from these medications. So medications were discovered, definitely. So we discovered multiple different antibiotics. We discovered treatments for mood disorders, depression, bipolar. We discovered treatments for schizophrenia, manic episodes, and all that. And we also started to look into the treatment options for different conditions like hypertension and diabetes. In this one say I want to show you, I did a quick search on drugs.com. I had to ask the question, how many therapeutic options do we have for hypertension? Guess what, guys? We already have 216 different pharmaceutical options for hypertension. Did a quick search as well for diabetes, and we have 158 different pharmaceutical options for diabetes. That's a lot of options for these types of conditions. And so is this model then really the one that works, right? So is the one drug, one disease model working? But if it is indeed working, then we would logically see a reduction in hypertension and diabetes across the years. As you produce more drugs, you give out more drugs, the incidence of the disease should start to come down slowly. I had an uncle before. He was working in Vietnam, and he said he was a country manager of a pharmaceutical company there before. And he said, Raymond, when at the end of World War II and at the end of the Vietnam War, we were treating malaria. So we pumped anti-malarial drugs into the country. Within the next 5 years, we found out that as we checked how many people got malaria, indeed the incidence of malaria started to go down. But if we look at the data today, especially this is from the Philippines, from 2009 to 2019, we have the same problems despite all the pharmaceutical options on the market. So what are we really doing, guys? What are we trying to treat with these medications? Are we missing the picture? Are we then trying to use a square peg, trying to put it inside a round hole? So heart disease is still number one, strokes number one, chronic kidney disease went up to number 4 from 6, diabetes went up from 7 to 6. A slow creeper in incidence of disease right now is cancer as well. So we'll see that in the charts sooner or later. And so with that question in mind, scientists in the US and actually across the world started to ask that question. What are we really trying to do from a primary healthcare perspective? Why is it that when I give my patient a medication for hyperacidity, 10 years down the line, there's a side effect that I have to cover with another medication. And then 5 years down the line, I have to cover that again with another medication. And then the side effects just start to grow and grow. And so this concept of healthcare was then birthed, and they said, maybe we have to think of the problem as a problem that is interconnected unto itself, that there's this science of biology, that there's a system of biology that we can start to understand so that we can see how the dominoes would fall as they connect from one domino to the next. And that's really where we bring this perspective to light, that this medicine that we're trying to share to you is not alternative or integrative medicine. This is science-based approach called systems biology. And that the main perspective from all the research that's been done across the years is that our bodies are built to respond to the environment that we live in, internal and externally. If we take this photo, for example, the little lady in the middle, if we bring her to the left side of the photo, good air, good water, good sunlight, clean, we have good social connection, good food, no toxins, no infections, then her body starts to express health from the core inside out. And that then becomes a very functional way of living with the environment. If we then bring this person to the right side of the photo, expose her to radiation, expose her to no open spaces, poor air quality, poor water quality, poor food, we have social isolation, then her body will naturally start to try to express dysfunction. Not because it wants to, but because the body is trying to respond and adapt to that type of environment. Quite frankly, toxin in, toxin out. And sometimes, some people can't even pull the toxins out because they're constipated, they're not sweating, they're not moving, or the food that's inside their body is just not enough to push the toxins out. Then dysfunction starts to come about. And so that's really the paradigm that we're going to come into as we discuss the details of the health camp. In this paper, they concluded the paper saying that, in today's world, ultimately our health and the health of all other systems on our planet depends on all the parts that comprise that one system. If one part of that system is dysfunctional, then it would logically then lead to dysfunctional other systems across that system. And that is now what we term as planetary health. It's a new concept in healthcare where we're looking at the subcellular space all the way to the planetary space, interconnecting each level at every sub level. So the challenge for us then in this day and age, 2020 moving forward, is how do we then bring ourselves, our families, our loved ones into this world where they can let their bodies run free, right? To be free once again in a world where we're not free. How poetic is that? So if we bring back and get the definitions in, so functional medicine is the model we're using, and it's a systems biology based model that empowers patients and practitioners to work together to try to achieve the highest expression of health for the patient's system at that current time. The root cause or the goal of every consult and exposure or interaction is to try to really ask the question, what is the underlying cause of the disease? What is creating the dysfunction from the root moving outwards? And so our definition for health then shifts from a one drug, one disease paradigm into a health equals your genes plus the environment that you live in. And scientifically, we're seeing that genetics plays about 20% of any condition. And there are these genetically inherent conditions that we've seen success with when we start to shift the environment. And so that begs the question, what then is our current environment, right? So if that's how health then becomes, what is the area or where are we living in? What's the spaces that our bodies are trying to run through or into? Well, first of all, we get exposed to this every day. I don't know any one of you who has not had steak or burgers or pizza or candy. I have nephews living here in the house, and every day, if you can give them candy, they'll eat candy every day. So this is a definite example of an environment that can ask genes to express differently. We know for a fact now, this is a recent publication, I believe this was in 2018, that there is a deep food crisis, that the rampant increase in the ultra-processed foods in our diet are already starting to load our bodies with empty calories, and that's leading to an empty calorie type of expression from people's genetic codes, therefore leading to symptoms. This is another deep issue we're seeing move up the the list of priorities. So if you didn't know, this is the first couple of years we were projecting a reduction in fertility across the world. For the first time since I think 1980, 1990, especially in the Philippines, if you notice the growth rates, in 1990, we were giving birth to 4.4 babies per couple, 2017, 3.1 babies per couple. We are expecting in 2100, there will only be 1.8 babies per couple. Whether it's because of social pressure, it's because of the environment, it's a mixture of all for sure, but I would like to make a case and say that environmental toxins and chemicals lead to infertility. So if you get exposed to BPA, phthalates, toxins, and all these forever chemicals, we see hormones being disrupted. We see reproductive organs shrink or change. We see female reproductive organs get masses. And finally, we see impairment of fetal growth and conception. So much so that if you're familiar with the lady Erin Brockovich, I hope you are. I think you are because the age group matches her movie about 20 years ago. So she wrote this article where they're seeing now a plummet in the penis size of men because of the forever chemicals found in male bodies. Now, it can be found in aftershave, it can be found in shaving cream, it can be found in soaps, shampoos. And these are chemicals that are so difficult to process that they start to stick in the body. And the body really tries to work with them, but if they can't work with it and clear it, it goes straight to the fatty tissue. Fattiest tissues in the body are the brain, the liver, and of course the fat. And so those are typically the people who have really, really a difficult time losing weight because it's not a carbohydrate issue, it's a toxin issue that they're dealing with. um, just a tidbit before we go to the next slides. Please look at all your water bottles. Make sure they are not PVC or V, number 3. Make sure that has the forever chemicals. Air pollution has been a deep problem for a long period of time. We've known about this since 2000s, I think. That's why there's this big drive on environmental cleanliness, I guess, and changing the way factories are emitting their smoke. But we knew this as well. These environmental pollutants can go into the body, into the subsegments of our body, into the organs, and lead to dysfunction because they start to lodge into those areas. The production of global plastics is another problem that we're faced with. I think about a month ago, I read a news article that the Philippines was number 7 in the world with the highest amount of plastic waste. And we're producing about 350 million tons a year. The plastic waste we produce goes from the factory to the city to the household to the garbage disposal area, and then they make their way into the ocean. And in the ocean, the fish will swim in them, will eat them, and then the microplastics are found in the fish. We eat the fish, so it all goes back around in that nice circle of life. This is the garbage island. I think it's in the Pacific. This is about the size of I think half of Texas or California, where all the plastic will just swirl in that area. And there's so much plastic out there that even in the fetuses of unborn babies, we have found microplastics in them. We feel, or scientists have seen and think that when the mom consumes the plastics, it goes into their intestinal tract. The intestinal tract, if it becomes leaky or damaged, the plastics can go into the intestinal tract, into the bloodstream, moving around the mom's body, and then from the bloodstream into the fetus of the child. So this is a very real problem. It's not, we're not imagining things now. And probably about 10 years ago, this documentary came out called 10 Americans. I'd like you to look for it on YouTube. And this was the first time they found that in an unborn child, there are about 287 different chemicals in the umbilical cord. So if we now try to look at all the risk factors for chronic illness that we're faced with today, we can subdivide these according to 3 different categories. Either it's an exposure to a toxin or a nutrition imbalance or a nutritional, so over-nutriture or an under-nutriture problem. We have air pollution, we have low fruits and veggies, indoor air pollution over there, drug use, we have diet low in veggies, low physical activity, and nutrition. And so the main question then is, if that's what we were before the start of the pandemic, what are we now? What's the current situation? Well, we know that COVID has hit us hard. No, not every country's been hit hard with COVID. And because of that, we've become socially isolated. We've started to work from home. And from that work from home environment, we have then started to, sorry, one second here. Okay. We have then started to change our environments to add more dysfunctional environments. So not just the exposure to COVID can get you sick, the processed food can get you sick, minimal movement, overwork and stress, the lack of physical connection, and the lack of purpose. So much so that there is now a red alert or a big crisis call from the World Health Organization saying that almost a fourth of our population has an underlying chronic medical condition and that because of the pandemic we are not servicing more than 50% of them across the diseases of hypertension, cancer, diabetes, and cardiovascular emergencies. And so it's therefore not a question of whether countries can afford to implement these types of changes during the pandemic, but will we make the changes during this time? That's where I'll kind of segue to the camp. No? So because of that problem, our team came together early part of late of last year, early this year, and we tried to strategize a way for families to come together to get healthy while they're cooped up at home. And so we started to develop this online health camp. The camp is structured in a 28-day cycle. So you have 4 weeks of the camp, and across the 4 weeks, we have different activities across the weeks. Our team is composed of 4 physicians, all functional medicine physicians. We have myself, Dr. Ron is on the call actually, Dr. Glad, Dr. Ven. We have a nutritionist, we have Ayer, we have a yoga instructor, yoga teacher, Nick, Nicolette or Nick. We have Coach Jaco, and we have Cheska, who helps us on the back end. The team then brings everyone together on week 0. So that's D-Day for everyone. And on D-Day, what we do is we orient you for this throughout the 4 weeks about the schedule, but everything you need to know within the entire month period. This is part of when we started orienting our past batches. So you'll see that notice how they look before and after. Okay, I'm going to show you photos across the different time points throughout the weeks. That's shown with permission, by the way. So week 1, we start getting kids into the yoga program if the kids want to do it. And we have a lecture on basic nutrition. On Tuesday, we have an adult yoga program. So the camp is subdivided into yoga and physical activity or exercise. There's 1 yoga class per week, and there are 2 exercise classes per week. We have another lecture on day 2, which is the Tuesday, about how to prepare healthy meals and how to limit the processed food in the meals during that one time. Apart from that, we have our kids yoga again on the Wednesday, and then a lecture on the Friday of week 1 about the elimination diet, because the elimination diet would be the main intervention from week 3 moving forward. Exercise classes occur on, I believe these are Tuesdays and Saturdays, if I'm not mistaken. Okay. When we taught our families for the previous batch on how to do elimination diet, they went crazy. On the left side, you have here a lamb. I forgot what the name of that. It's a Middle Eastern dish or Mediterranean dish. Middle Eastern, I think. Birria or birna, something like that. In the middle, you have someone just steaming and stir frying some red rice and veggies. On the right, you have oats arroz caldo or quinoa arroz caldo, I think was what they built in. So elimination diet friendly. Smoothies, lots of people are making smoothies left and right. The top one was a gluten-free, dairy-free cereal. They use almond milk. And then lower is a seaweed soup that they started to cook, which they just boil and they'd serve afterwards. Week 2's focus, so week 1 was nutrition. Week 2's focus is all about rest and relaxation. We're going to talk about the topics of, rest, relaxation, and movement, week 2 and 3. So you'll see here that the exercise schedules are the same, but we do have a mindfulness workshop on the Monday. So we're going to go through the science and topics of rest, relaxation, meditation. There's going to be a session where we're going to ask patients or the group to meditate and to try to share the experience after that. Then we have an exercise lecture on the Friday, and then you have a workout again on the Saturday. You'll notice that every Friday there is a FGD breakout room. This is when we do a lot of feedbacking. We start to do coaching. Each of the families, or the families, will be subdivided into three main groups, and each main group will rotate across all the instructors that have lectured. So for week one, for example, there'll be in this session, there'll be a 10-minute session on feedbacking, and I can host the FGD for nutrition. So how was the elimination diet? Are you okay? First week of elimination, how does it feel? Then after 10 minutes, we shift you over to probably Dr. Ven to talk about the mindfulness workshop. Were you mindful this week? When did you meditate? How's the feeling? Then we shift you over to Coach Jacko. Did you exercise this week? How's your exercise? And so on and so forth. You'll notice that the structure of the schedule is really to build habits, to try to keep you on point and on your toes. And the sessions are just 45 minutes, so it's not going to take up a lot of that day's time. I love this picture. This is a picture of everyone meditating for the first time during that one workshop where we ran the mindfulness workshop. You'll notice that even the kids are on the call, because we've seen that if the family does it together, it just becomes multiplicative on the effectiveness across everyone there. These are some photos of the kids yoga. So you'll notice that the kids are, just to tell you the truth, the parents never really thought that the kids would get into it, but after the first session, the kids just went to every session afterwards. They really loved the classes. Week 3 is all about a continuation of rest and relaxation. You'll notice that the lecture on the Monday is the science of sleep, and then you have the same physical activity schedule moving forward, and you have the breakout room. At the end of week 3, we have our mindfulness workshop, the second one, and we have our exercise on Saturday morning. All sessions, just to let you know, are recorded. And so if you want to watch the session, you can't attend lecture live, you can always get the recording and do the session the day after or the same day. These are our exercise attendees, and it's a 45-minute. I tell you, this is tough stuff. The instructors join in as well, to get close to everyone. So on week 4, this is the last week of the camp. We have on the Monday a looking back, looking ahead session where we host a group discussion about what you learned, how's the experience, and how you can push forward with the recommendations. You have your exercise sessions and yoga sessions as well. And finally, on the Friday, we have graduation, where we do a little ceremony and we send you off into the world after that entire program. So we're working on the 4 lifestyle foundations, actually 5: nutrition, rest and relaxation, movement, and purpose. And we're using these tools to get you through. And I'd like to show you a couple of the results from the first batch. You'll notice here AH, she was a 34-year-old businesswoman. And you'll notice that her body mass index was 25. That's higher for an Asian. Waist to hip ratio was 0.9. That is actually, I believe we want less than 1. I think Rona will correct me later. I forgot what the waist hip ratio is. Then you'll have here a
7.
scorecard for the medical symptoms question. 0.7, Rona. Thank you for that. So she's over the waist hip ratio. And you'll see here her symptoms across the different subsegments of the body. Her total score was 50, meaning she was feeling different things across the body. On the right side, you have here her habits tracker. So she was only doing exercise and limiting processed food before the camp. And we have here the mindfulness attention. How mindful was she of her day-to-day activities? And finally, here promise score is a verified measure for health that we use globally. And so you see her score was a 44.5 and 43. This is our second lady. She's a male, sorry, participant, 55-year-old lawyer. He was really overweight, 39.2 kilos. He had very high waist hip ratio, and the symptom score was a 69. Symptom scores we want below 15, below 10. So these guys were pretty inflamed. And he was not doing a lot of habits. I believe he was just hydrating properly. Baseline, he wasn't super mindful. 3.6 out of a score of 5, and 33 and 44 for the global assessment scale, the PROMIS score. So this is when we graduated, everyone. Notice the faces. You'll notice that the faces started to thin out. There's now a glow. And we tracked the habits that they formed. So before the camp, you can see that most of them really had no habits for health. 33% for sleeping well, 33% exercise, 67% avoided processed foods. 0% we have here that who ate the 5 different colors of fruit and veggie, and we have 33% drinking at least 2 liters of water. After 4 weeks, you'll see the change in the habits, and across all the scales, you have an improvement in behavior. So better sleep, better exercise, better mindfulness, better eating of no processed food, more colors, and more hydration. Symptoms questionnaire scores across the participants. We saw a shift across all subscales. So the dark green was the baseline, light green was the one after the camp. We saw also a shift, mostly guys, we saw a shift in mental health and mood after the camp. Higher score in both, leading to better health. And if we go back to our 2 cases, we have AH and our male lawyer. You'll notice a shift from the symptom score from 50 to 11. We had a 1 BMI shift in AH, but you'll notice that she started to increase her habits, healthy habits, and we started to increase as well the post-program mindfulness scale, and of course, an improvement in physical health and mental health afterwards. Same thing for our lawyer. Shifting the symptoms questionnaire from 69 to 27, we have our body index coming down as well. And, the habits started to form here. So the exercise was the only thing that he had been lacking at the end of the camp. Improvement across those scales. With that, I'd like to invite everyone on the call to join us for the August camp. Our batch 2 is in August 2 to August 27. Again, all the sessions are recorded. You can, if you can't join that one session, but it's super fun. I promise you. All the instructors are there. We have a good time doing it. And signups are here, or you can message Cheska or Nick. I think they're gonna message you after. And those are the fees that we have for the whole month. Just note that +1 could be your friend or your spouse or your significant other. Individuals are 6.5. Then the family, no matter how many are you. The last batch we had, one family had, I think, about 9 or 8 in one household. So that's totally fine for us. We really wanna get all those big families in. And yeah, I hope we can get started with everyone in the call. So with that, Chess, thanks. Yeah, maybe they have some questions about the camp.
Thanks, Doc Raymond.